You know, here in Polk County, there's an organization that has a great reputation for mental health services. But they're looking to branch out a little bit more and actually take care of the whole person through Wellness Clinic. Here to talk to us today about their new Wellness Clinic from the Peace River Center is Mary Jane Oglesby. She is the Director of Recovery Services. And we also have Karen Moore, and she is the Wellness Clinic Manager. Ladies, thank you so much for coming on.
Well, thank you for having us.
Now, this is really interesting because this is an area that the Peace River Center hasn't really branched out into previously. Tell us a little bit about how the program is going to work. What are some of the details?
We had this awesome opportunity to be part of a grant opportunity to start primary care services. There's a national trend to offer primary care services along with behavioral health services, and the trend is basically called integrated health care. And what that is, that's integrating the care for your health needs and for your behavioral health needs. It's the mind and body being treated together.
Right.
So the integration is bringing the neck into it and bringing it all together. We've looked at this for a few years at our organization. We've talked about it. We've looked into how we would do this, but unfortunately didn't have the opportunity to do so until we were able to be part of this low-income pool grant, and that gave us the opportunity to start this program and to have the startup monies for it.
Yeah, well, I think it's a very interesting evolution because you look at the health of people and where things, and it all correlates. It all, it all works together. How does the clinic actually work? I mean, do people get referred to it? Tell us a little bit about that.
We'll get referrals from within the organization and from outside. And so we've not opened up yet. We're going to open in a week, and we're very excited about it.
Oh, that's terrific.
I've been taking care of the mental health population for 25 years in this community, and just have really seen the need for the integration of the two. Patients are so many times so overwhelmed with their psychiatric symptoms that if those symptoms are under control, then they're not thinking about their high blood pressure or their diabetes, and they're not focused on that, and so they don't get care for that. They don't see it as a priority, so they don't seek care. And so we're really happy to be able to be in a position to make that happen now. The mental health population generally die 25 years sooner than the mainstream population because of untreated medical conditions.
Wow.
Yeah. So
when you're talking about mental health issues, that feeds down into physical health issues. Developing a program like this, Mary Jane, you had mentioned that this was something that you've been looking at for quite a while. You now have the funding for it. What goes into starting up a wellness clinic like this with an organization that was primarily, mental health?
It's been a huge undertaking for us, I can tell you, especially for myself. I'm a licensed mental health counselor, and I'm not an RN like Karen, so it's been a learning curve for the two of us. But it's been a joint venture with all of us. A lot of people putting their heads together. Everything from finding the correct facility to ordering the supplies, and just seeing how it's going to go as far as offering this type of service, looking at the services that we can provide. And knowing what our population would benefit from. Like Karen said, the seriously mentally ill do die much earlier.
Right.
But also statistics show that 77% of antidepressants are prescribed by primary care doctors. So on the flip side, persons that have depression aren't also seeking their behavioral health treatment.
Right.
And so again, we can bring all that together.
And that's great because not only does the physical health correlate with the mental health correlates with the physical health. So, like you said, the doctors that are taking care of people don't necessarily look into the psychiatric portion of it and how those things correlate.
Absolutely.
Now, I can imagine that the Peace River Center has referred patients to doctors and things like that in the past, but being able to refer them to your own wellness clinic, I'm sure, is a huge financial benefit as well.
It is, and it's also a great convenience for the people that we serve. You know, it's one-stop shopping.
Right.
A lot of persons, you know, they can be seen at our wellness clinic, walk right across the breezeway, and be seen at the outpatient psychiatric clinic as well. And another thing that we found, you know, obviously, you know, since this our low-income pool grant is for people who are uninsured and underinsured. So people who don't have benefits, who don't have Medicaid or Medicare, can seek services there as well. That's going to reduce emergency room visits. It's going to reduce people that aren't seeking services for their primary care because they don't have insurance.
So this, the new wellness clinic that you're opening up, doesn't have to be, you don't have to already have mental health services with Peace River Center. You can just walk in and use them as a primary care.
That's right. That's exactly, you know, our primary population will be people who have behavioral health disorders, but the grant is for anyone who is uninsured or underinsured. They're a full-time resident of Polk County between the ages of 18 and 64 and at or below 200% of the federal poverty guidelines.
Mm-hmm. That's terrific. I mean, that's huge for a community too, because when you have a location like that that's easily accessible, how beneficial that is for the residents just right around that area. And I think that's kind of a theme that we see going on in healthcare now, is instead of big giant healthcare, things are getting shrunk down to smaller.
We are moving to more of a medical home model. Karen and I've laughed about it. You know, back in the old days when we were growing up, you went to one doctor, and that doctor took care of, you know, they may have been there for your delivery and taken care of you through your childhood, through adulthood, and then delivered your children. And that's just the way that the model used to be. And we're somewhat going back to that with having medical homes, and that all your care is taken care of in one place.
Now, just I'm just kind of curious about this. When you open, what do you expect with your opening? Is it going to be a floodgate of people coming in? You know, or is it just mostly right now get the word out?
It's mostly getting the word out right now. We've mostly been able to market within the organization, so the patients that we have already, those are the ones that know of our clinic, and we're speaking to those people first. So that's what we expect to be trickling in. But when word gets out, we expect to be really busy. So we're really looking forward to that. And we're really delighted the facility is right next to the Gilmore outpatient mental health facility, so it's going to be very convenient and accessible to them, and we're going to create a really welcoming environment where they'll feel comfortable coming and getting all their care.
Now the Gilmore facility, that's in
Lakeland.
Near the Tiger Stadium, right?
Just south of it, yes.
Okay.
And yeah, the low-income pool grant it's a joint venture between the Polk Health Plan, Lakeland Regional Medical Center, and the Polk County Health Department and Peace River Center, so that Lakeland Regional has the Family Health Center that they've opened up with the funds from this grant, and they're diverting people from the emergency room. And then the Polk County Health Department is also offering primary care. So it's a huge opportunity for the persons in our community who don't have access to primary care.
That's terrific. How does, you know, we're trying to get the word out here about the wellness clinic. How does somebody, I mean, do they have to schedule appointments, or is it just walk in, or could it be either or? What's your preference here?
Well, certainly, if we could have everything be appointments, that would be convenient. But we're anticipating walk-ins, and we're prepared for walk-ins. So
to make an appointment, what do you have to do? I mean, is there a website you have to go on to, phone number?
There's a phone number. It's 519-0930, if I'm not mistaken.
Okay. Now, Mary Jane, you've been with the Peace River Center for quite some time now.
28 years.
Yeah, so you've seen a lot of different things about the Peace River Center. Can you just kind of tell us a little bit about some of the other services that happen with the organization, and you know, what's available? We've obviously talked about the new wellness clinic, but there's so many other things that that people need to be aware of.
Services we serve persons from infancy to adulthood. We have an array of outpatient services. We have 3 outpatient clinics that have psychiatrists and therapists serving children and adults. We have a wide array of what we call recovery-based services, which are the programs I'm over. And those are services primarily for persons with serious mental illnesses. We have day programming where they can go to sort of like mental health school, where they go
Right.
to classes and they learn about their illness, they learn symptoms management, they learn about their medications. We have work programs like our Club Success, which is a work order day, and it's where persons can go and they basically run the clubhouse and they learn skills to get back on the job. We have residential treatment for persons who are, say, coming from a state hospital or our crisis unit, and they need that transitional period to learn the skills to live independently. We also are unique in the sense that we are, I think, the only community mental health center in the state that has 2 domestic violence shelters. So we do offer victim services, a rape recovery program as well. So we're pretty diverse. We have about 375 employees, and of course our crisis stabilization unit, which is Baker Act Receiving Facility. It's like an emergency room for persons who are having mental health problems, and a short-term residential treatment program that's sort of a go-between being in the crisis unit and being in a state hospital, so you can be there anywhere from like 6 to 9 months.
Yeah, it just amazes me. I mean, the Peace River Center has been around for quite some time now, and they've really kind of implanted themselves in the community, and such a great organization, and the services they provide are absolutely vital. Ladies, this sounds exciting. The new wellness clinic that you guys are opening up, it's a great step in the right direction.
Absolutely.
And I wish you the best of luck, and I'm pretty sure that you're going to fill the place up really quick.
That's what we hope so.
Thank you for coming on.
Okay, thank you.
That's the Peace River Center, their new wellness clinic. It's actually right across the street from the Gilmore complex there in Lakeland. You can find that at 1831 North Gilmore Avenue in Lakeland. They will begin seeing patients on March 4th, Monday through Friday from 8 o'clock to 5 o'clock. To contact them, you can call 863-519-0930 or find them on the website at peacerivercenter.org.